7 a.m. here in Seoul. I'm Lee Kyung-eun at the Arirang News Center. We're breaking into our regular session to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Health Ministry official Yoon Tae-ho will be giving us details on the COVID-19 situation here in the country. He'll fill us on the number of new infections as of midnight and the efforts that the government is making to contain the virus, especially with continuing cluster infections here in Seoul and the surrounding capital region. To give you a brief idea as we wait, South Korea reported 967 new cases on Thursday, with numbers still hovering around the 1,000 mark. The recent spike is partly due to a major outbreak at the Dongbu Detention Center here in Seoul. We're cutting to the briefing now. Take a listen.
Let us now begin our regular briefing for December 31st, Thursday. This is the last briefing of the year. And as of today midnight, we have 940 new local infections. And at the temporary screening centers in the metropolitan area, we have confirmed 133 new patients. And yesterday, we had 21 additional fatalities. And I extend my deepest condolences to the deceased and the members of the bereaved families. We are carrying out social distancing measures and massive testings, and we are seeing a downturn in our domestic cases, especially in the metropolitan area. And we are able to contain a further rapid surge in the outbreak. And we have yet to see clear signs of a clear decline in the number of cases. We need to contain the virus spread, and also we need to transition into a phase where we can overturn the spread of the virus. Here are some updates on our quarantine response yesterday nationwide at all of the nationwide screening centers with suspicious symptoms. We had 54,000 cases of testings conducted, and we conducted about 40,000 testings at the metropolitan area through the temporary testing centers. And in total, we carried out 95,000 tests on a daily basis. And in the metropolitan area, the makeshift testing centers have identified 1,700 positive cases so far by conducting over 634,000 cases so far. And we will be extending the operations of these facilities. And during the New Year holidays, if you have any suspected symptoms, we ask you to get tested as soon as possible. Starting from next year at the nursing hospitals and nursing care centers, as well as mental care hospitals, we will be carrying out extended testings for these virus-vulnerable facilities. All of the people who are working at these facilities will get tested every 1 year, every 1 week that is, and we will also add these welfare facilities for the disabled who will be subject to these testings. Here are some updates on our medical capacity here in the country, and in the metropolitan area, we have 41 patients who are waiting to be admitted to the hospitals for over a day, and this is under our goal of having a 2-digit number. And currently, we have 7,800 beds in the Life Treatment Center, and we can house about 10,000 patients for the COVID-19 patients. And as for the COVID-19 designated hospitals, we have currently 538 hospitals that are available. And in the metropolitan area, we can utilize 94 beds immediately. And as we have cluster infections breaking out at nursing hospitals, here are some response measures. In the Seoul's Gurogu district, in relation to a nursing hospital there, we have specific detailed quarantine measures. We had 37 positive cases who are staying at the nursing hospital, and we transmitted 36 of these positive cases to other hospital, and the rest 1 person will also be admitted to another hospital. And as for the 95 people who have tested negative, we will also dispatch a nurse and doctors so that we can treat and we can monitor their conditions. And we will also look into the other nursing hospitals hospitals and also 3 other mental care centers, as well as 1 welfare facility for the disabled. We have carried out a detailed on-site monitoring and inspection. And as for the nursing hospitals, we have also moved a majority of the patients to other hospitals. And as for other 2 nursing hospitals which still house the COVID-19 patients, we will also provide more hospitals to transmit these confirmed cases and provide more medical supply as well. And we will also designate the hospitals for the COVID-19, and we will also provide more supplies as well. And going forward, we will also designate more mental care hospitals as COVID-19 treatment hospitals so that we can treat these hospitals effectively. And as for the disabled facility, we also we were able to transit 41 COVID-19 cases to other hospitals, and we will also provide 3 nurses to provide treatment and care. And as for the special year-end holiday measures, we will also be extending them until January 3rd, and this is also when the social distancing level 2.5 in the metropolitan area and level 2 nationwide will also come to a close. And we are also opening our ears to the experts, and today we will have a quarantine. We had a quarantine and health authorities meeting and to adjust to these social distancing measures, and the final decision will be decided today. And we will also have a special campaign to promote communication with the public, and we will provide more content of encouragement for the public throughout the next month. And we will also have special videos of dance and music so that we can promote the quarantine guidelines for the public in an entertainment manner. And we will also provide these videos until the January. And also sometime in January, we will also have special welfare facilities and policies which will also be provided in a similar manner. And we will also have a similar video that will promote similar campaigns as well that involve the drone deliveries for the senior citizens. And all of these campaign videos will be available online. Today is the last day of 2020, and we would also never forget this year, which has been full with fighting against the COVID-19. And this year is coming to an end, and it does not mean that if we usher in a new year, we will also be able to combat the COVID-19. However, as the new year comes, we will be renewing our resolves so that we can come to an end in our battle against COVID-19, and we will also exert our full efforts to return back to normal. So we ask the public to also join us in practicing the quarantine measures, and until then, we ask for you to muster your energy and strength. Please minimize your social gatherings and also social meetings, and please never forget to wear your face mask at all times. And if you have any suspected symptoms, please get tested as soon as possible. And please also do not go to these year-end gatherings because all of the year-end destinations are coming to a close. However, please enjoy New Year celebrations virtually and remotely. We understand that it is a very difficult situation where we cannot meet with your relatives and family members. However, we ask you to usher in a New Year celebration. Happy New Year to you all. Thank you very much.
네, 다음으로 이기일 보건.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 967 new cases on Thursday, with numbers still hovering around the 1,000 mark. Of them, 940 were locally transmitted and 27 were from overseas. There have been 21 more deaths, bringing the death toll to 900. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.
No place is safe from COVID-19 these days. A new measure has been enforced to prevent the spread during the holiday season.